morning, everyone. I'm Dr. Krishna Priya. Today I'm going to speak about correlation of AC by A ratio and stereoacuity in myopes. There is no financial interest to disclose. And coming to introduction, what is myopia? It is a type of refractive error in which parallel rays of light coming from infinity are focused in front of retina when accommodation is at rest. Prevalence of myopia is about 3.6 to 36.5% in Andhra Pradesh, and American Optometric Association has defined 3 grades of myopia, divided into low myopia with less than or equal to 3 diopters, moderate myopia 3 to 6 diopters, high myopia more than 6 diopters. AC by A ratio, it is the measurement of convergence induced by accommodation per diopter of accommodation. In other words, it's a relation between accommodative convergence expressed in prism diopters and accommodation expressed in lens diopters. This relation is linear and relatively stable throughout the life. Normal AC by A ratio is about 3 to 5 prism diopters for one diopteric of accommodation. It is measured by heterophoric method and gradient method. Stereoacuity is a measure of ability of the eye to detect horizontal minimal disparity beyond which no stereoscopic effect is produced. This limiting disparity characterizes person's stereoscopic acuity. Normal stereoacuity is about 40 to 60 seconds of R. Stereoacuity is excellent at fovea but decreases from center to periphery of the retina. It is assessed by using Titmus flight test, TNO dot test, Frisbee test, and Langhans test. And aim to study the correlation between AC by A ratio and the stereoacuity in myopes. Objectives: to study AC by A ratio in various degrees of myopia, to study stereoacuity in various degrees of myopia, to study correlation between AC by A ratio and uh, stereoacuity in various degrees of myopia. Coming to materials and methods, study type is prospective observational study, duration 3 months. I have taken sample size of 45 by convenient sampling. And inclusion criteria: myopic patients more than 5 years of age, and exclusion: amblyopia, keratoconus, congenital cataract, congenital glaucoma, and any other ocular pathologies. Methodology: obtained institutional research committee and ethics committee approval, taken written informed consent, and a total of 45 patients will be considered and divided into 3 groups: low, moderate, and high myopia. Children have undergone routine subjective refraction and ophthalmological examination and followed by AC by A ratio, by heterophoric method and gradient, and stereoacuity by Titmus flight test. Statistical analysis: Pearson correlation coefficient was used to correlate between AC by A ratio in each group, and ANOVA test is used to compare between 3 groups, and P is considered to be significant. And coming to results, AC by A ratio, on increasing myopia, there has been increase in AC by A ratio significance, and also significant difference between significant reduction in stereoacuity with increase in myopia, and there is a negative correlation present between AC by A ratio and stereoacuity that indicates increase in myopia increases AC by A ratio, which decreases stereoacuity. And coming to discussion, in this study there is a significant difference between AC by A ratio and stereoacuity with increasing myopia, and negative correlation between them on increasing myopia. And my GH et al. Study concluded that emetropia could have affected stereoacuity through reduced visual acuity and possibly other factors, which is similar to our study results where increase in myopia have reduced stereoacuity. And Vivekanand et al. Study shows that in a group with myopia, more than 3 diopters have a high AC by A ratio than in group with myopia less than 3 diopters, which is similar to our study. And in conclusion, with increase in myopia, there is an inverse relationship and negative correlation between AC by A ratio and stereoacuity were observed. These are my references. Thank you.
Which is the best method to assess a stereoacuity?
I have done Titmus flight test, sir.
Okay.
It is usually done even for adults. It is most easiest and to explain to the patients.
Yes.
And it will be easier to them, sir. So
Okay. Are there any monoocular cues in Titmus fly test?
Yes, sir.
Yes.
In one box there is darker one to mislead the
Yeah.
stereoacuity.
And then you did the statistics with the logarithmic value or the stereoacuity value you got?
Logarithmic, like there are we measure as it is in Titmus flight test we have seconds of arc, sir.
Yes.
So according to that I have taken the value and have done the measurements, sir.
No, you measured the direct value of stereoacuity.
Yes, sir.
Not the logarithmic
No,
value.
sir.
That's not correct.
Okay.
Okay, you have to do the logarithmic value and then you have to do the statistics with the logarithmic value.
Okay, sir.
Because stereoacuity is it's not in an arithmetic progression. It is a logarithmic progression. Okay. So,
Thank
any
you, sir.
questions from the audience?
Yes, ma'am. Yeah, yes, ma'am. I have done, ma'am.
You have done cover.
Yes, ma'am.
So there are no exophorias at
For some people, there have exophorias and esophorias, ma'am. Like latent, ma'am. Not they have latent. There is no exotropias, ma'am. I have excluded exotropias and esotropias. Any on cover and uncover test, we have taken esophorias and esotropias, ma'am.
Well, that also affects the stereoacuity.
Yes.
Okay. Yes. Nice presentation. Thank you.